Good day. I'm Charles Knighton. I live in Las Vegas, Nevada, and just like many of you, I'm a citizen who worries about the direction of America. Our country is beset with many challenges, and the biggest of these is health care. In recent studies, almost 80% of us agree that the rising cost of health care is a real threat to the future of our nation, and almost two-thirds of American adults want to see some form of a national health care program instituted. So why don't we have a national health care program? Why are citizens of this republic waiting for the president or Congress or even the courts to do something about this issue? 5 years ago, I began to think about this question and concluded that we don't have a national health care plan in America because of injustice. And so I asked, what constitutes a just society? I am not the first nor last to ask this question. We all think about it at some time or some point in our lives. For the search to establish a just society is older than the pyramids and as recent as yesterday's headlines in the New York Times. For thousands of years, countless philosophers like Aristotle have struggled to find and build codes of ethics where their views of justice and the just society played a part. In his time, Aristotle correctly concluded that justice is a state of people having their proper due, while injustice involves people having either too much or too little. There have been many voices raised in opposition to and support of America's health insurance industry, yet most of these voices ignore the question of simple justice. Is it just that some people, CEOs and executives of health insurance companies, have so much in the form of multi-million-dollar employment packages, and some people, a vast pool of the working class in our nation, have little or no health coverage? I think, as one who believes in Aristotle's concept of justice, that it is not right for such a condition to exist, with many of our fellow citizens suffering without health coverage and others laboring with inadequate Walmart-like health plans to continue. This injustice compels me to act. As a citizen, I created and wrote a comprehensive health care plan for America 5 years ago and sent out copies to some of the leaders of our country, including a former president, U.S. senators, political consultants, the movers and shakers of our nation. These were people who had professed an interest in supporting universal health care for citizens. Well, you can guess what happened. Not one of these leaders responded properly. Publicly, they pay lip service to creating a solution to the health care crisis, but then they don't propose any specific bills in Congress, nor do they seem to support those who might have a solution to the crisis we face. This lack of real vision and courage has left the issue of health care reform in the hands of the insurance companies, their lobbyists, and their allies, many of whom are in the Republican Party. And frankly, the modern Republican Party since 1980 has not been a great supporter of adequate and affordable health care for working-class Americans. Mostly Republican presidents have misled the executive branch of the federal government for the past 26 years and have done nothing. They've done nothing about the runaway increases in premiums. They've done nothing about the increasing numbers of working-class people without coverage. They've done nothing about the total compensation packages offered to executives of health insurance companies. In short, they have done nothing but blame the people, that's you and me, for being bad consumers of health care. Now, the latest in this parade of Republican presidents has presented his plan. Mr. Bush wants to give more tax breaks to those fortunate few who are able to put away an additional $3,000 a year into a health savings account. Mr. President, make clear to us what your plan would do for the vast majority of working-class families in America. Families with 2, 3, and sometimes 4 jobs who still struggle to make their financial ends meet. Working-class families where having leftover dollars for a savings account is as elusive as is finding lasting peace in the Middle East. How can families who are trying to survive in an environment of more and more American companies cutting back on health care benefits scrape up an additional $250 a month to fully take advantage of your plan? Only somebody like you, Mr. President, born into a world of privilege, and a group committed to 19th century dog-eat-dog capitalism like the Republican Party can support such a program. I cannot and I will not support you. Because you see, Mr. President, it is a question of simple justice, and your scheme is not just. Without a real national health care plan that covers all of our people, America risks becoming a place where the social fabric that binds us together is in grave danger of being pulled and stretched to a breaking point. We risk becoming a gladiatorial arena of those who got, those who need, and those who want adequate health care and coverage. We see the signs all around us, as far too many people are filing bankruptcy because they cannot pay the deductibles, the capped out-of-pocket costs, and reasonable customary charges of our nation's health insurance providers. And these are the lucky Americans who still have what is considered good health coverage, but have the temerity to get sick and call upon their health plans to take care of them. For others, it is far worse. These are the people who played by all of the rules. They work each day. They pay taxes. They abide by the laws of the land, well, except occasionally breaking the speed limit while rushing to the second or third part-time job taken to make ends meet. They've done everything asked of them as good Americans, and yet they have no health insurance. They are the nameless and mostly forgotten working-class Americans, too young for Medicare and too rich for Medicaid. They watch with muted voices as Republicans and Democrats crisscross our nation every 2 years, promising to make sure the aged, the very poor, have proper health coverage, and the people of Iraq have security. And they ask themselves, what about my security? What about my health coverage? Now, the chickens are coming home to roost. What are we to make of a country which spends 50% more per person on health care than any other nation on this earth, and yet leaves over 50% of its, over 50 million rather, of its citizens in any given year without health coverage? Is this justice, or is it injustice? In your heart and soul, I think you know the answer. We all know something is not right, because in the past we saw those without health insurance coverage as only the very poor or the unemployed, those other people across town. But now we see them in our part of town and in our own families. We see them in every community of our nation, from Nassau County, New York, to Clark County, Nevada, and beyond. We all know something is wrong because we feel it deep down within our souls as we watch yet another story on the cable news networks about health insurance premiums spiraling out of control. And we are afraid, very afraid, that our employer will scrap our current health insurance for a cheaper plan, one which we cannot afford to live with, but clearly we cannot afford to live without. We wonder if the American dream is passing us by, and we wonder how we ended up here. The fact that we are in a crisis today does not mean we must be there tomorrow. We can do better by remembering who we are as a people and what we can stand for as a nation.